Hi, it's Tara. I am just doing an updated video on my post DAO. I think I was calling it DOA, but it's actually called a DAO procedure, which I had about a month and a half ago now. I had it mid-December and it is January 21st, 2025. So it's been probably 6 weeks, I would say, since I had the procedure done. So I'm just going to do a quick video, giving an update. I wanted to wait, a good month out because I think at this point, this is pretty much kind of the final product, as you would say. Initially, right after I had it done, there was, a lot of swelling for the first couple days, and then that started to go down over the next week. And that was all, to be expected from this. But at this point, I would say I'm fully recovered. The stitches, the dissolvable stitches that they put inside my mouth after obviously doing the incision and messing around in there. The stitches are gone. It's, I guess, fully healed at this point. I can feel, what kind of feels like a scar, I guess you would say, right inside, right here. And it's still a little tender actually now that I am touching in there, very slightly, and a little bit of kind of like a firmness in this area, which I believe will probably continue to go down over the next handful of months. You can't see it. It doesn't, impact me at all, but I can kind of feel it when I touch here. And then again, a little tenderness when I push my hand inside my mouth. But anyway, so I guess the whole purpose of doing this procedure was, one, to try and see if we can get some of my smile back. That was part of it. And then the other part of it was to resolve some of the tension in my cheek from the synkinesis. So I would say, as far as those two objectives, the tightness in my cheek is significantly better since doing the procedure. It's a little hard to know how much of it is because of the procedure and how much of it is they also did a round of Botox immediately after the DAO. So, and that's still kind of pretty much in effect right now. So it's possible that it's, also the Botox that's causing the less stiffness and tightness in my cheek. But I do think a lot of it is the DAO. And the reason for that is, and I'm probably going to jump around a little bit in this video, but one of the things that was really interesting when they're in there, so basically, I guess real quick, so they numbed the area. It was just in the doctor's, it's just in like a procedure room. It wasn't like in an OR or anything like that, but they numbed the area. And then I can't see obviously what's going on. It was interesting because the doctor had a visiting doctor in, who was observing the procedure. So my doctor was kind of verbally walking through the whole process with this visiting doctor. So it was interesting and a little nerve-wracking, to be honest, to kind of hear what she was doing, even though I couldn't really feel it. It's like if you have any kind of like an oral procedure, like a tooth extraction or something, you can feel pressure or tugging and weird things, weird smells, but you can't like feel pain or anything. But so it was interesting to kind of know, what she was doing in there just because she was verbalizing it to this other doctor. So anyway, so basically they numbed me up. And then they use something to kind of hold, I guess, my, mouth open, just because the whole goal was to access this little internal area right in here, right there. So really right at the edge of my mouth. And, they obviously cut that area open. They exposed the muscle fibers inside. And then the whole procedure took probably, I don't even know, maybe 45 minutes. I feel like I was in there for a long time, to be honest with you, because it wasn't fun. But it could have been shorter. I don't know. But in my mind, it was about 45 minutes. And so they opened the area up, and then I could hear the doctor. Like I said, she's telling the other doctor, they're moving this muscle aside, and oh, see, here's the muscle from the DAO muscle, and that's the one that that they want to work on. And she used some kind of like a solder thing, or I could smell like burning flesh. I know that sounds so gross, but they used something to basically cut through the muscle fibers and also to I think they remove some of the muscle tissue. Because I think what happens over time when you have the synkinesis is that you're basically working this muscle all the time. It's overworked. And so you're literally building up muscle fibers. So I think part of this is taking out some of those muscle fibers that are obviously, in a typical person, you wouldn't have that buildup, but in somebody with synkinesis, you do. So they take those muscle fibers out, they cut through this DAO to kind of, release some of that tightness, that muscle tightness. And at one point during the procedure, it was so crazy. She was saying something to the other doctor about what she was doing, cutting something or what have you. And all of a sudden, it was just like a relaxing in my cheek. Just like a relaxing feeling is the best way that I can describe it. And, for a very long time now, I've dealt with this chronic tightness. And it is something you kind of get used to, but it's also something you don't fully get used to. So when she did this, whatever she cut at that moment, it was just like a relax. So I think that is, again, one of the goals of this procedure and one of the things that I did experience, which is why I feel like that tightness that I feel, and it can be exacerbated like when I'm stressed out or whatever. And it makes me kind of want to go in and do that massage to kind of loosen out my cheek. I haven't felt the need to do that since having the procedure done. And I think that is because of cutting through and, releasing that muscle tightness. So that's really good. And then as far as my smile, so let me go back real quick. So that's pretty much it. There really isn't a lot more that I can explain. So they did the procedure, they sutured it up with the dissolvable stitches, and then I had the Botox done, and then within a few hours, I started to swell up, just like if you had like a tooth removed, and I had like a big chipmunk, cheek for about 24 hours, 48 hours. And then that started to resolve. And then for, I would say, a couple weeks, I was more swollen, and it just, every day gradually the swelling decreased to the point that it was gone. So the recovery was really easy. I didn't have any complications. It, other than kind of aesthetically looking like a chipmunk, it really wasn't a big deal. The procedure itself, I think, was not so much physically difficult. It wasn't painful or anything. It was emotionally difficult, for me. And I think a lot of that is I'm not a person who is an elective, cosmetic surgery person. Like, I'm not somebody who would ever get things done to my face or my body to try and enhance the way that I look. And I think there was like a moment when I was doing this, so kind of just like, a realization of like what I've been through, and how much, for good and for bad, this situation, this, facial palsy has changed my life. And it's had a lot of challenges in the past 2.5 years. I've grown a lot. I think I'm a lot stronger, as a result of what's happened to me. But it's still been challenging. And so I think that was kind of like a moment when I was sitting in that chair doing this, thinking like, whoa, like how did this happen? Like, how did this happen? How did I get here? And then obviously a fear of, what if something went wrong? And, I did this thing largely out of vanity. And what if it doesn't work out right? And what if they cut through something and now my face is sagging even more and I can't talk right? It's just a lot of those thoughts were kind of going through my mind, and thinking like, I chose to do this. I'm not in any kind of medical danger. I didn't need to have this DAO procedure done. And what if I made a mistake in deciding to do it? So those were all kind of thoughts going through my mind. So after it was done, I just felt kind of emotionally depleted. But again, long story short, I do not regret doing it. If anything, I'm happy that I did it. It improved things in my face. And I waited, 2.5 years from my initial diagnosis to decide to do it. So it wasn't like a hasty decision that I made on my part. And I'm, obviously very grateful that I even had the opportunity to have this done, because I know there are probably a lot of people who don't have access to this type of care. And I'm very fortunate that this was an option that was presented to me. So that is the procedure. Going again, feels more relaxed, in my cheek, and then my smile. So I will smile closed mouth first, just so you can see it. And then I'll smile open mouth. Hold on. So obviously the open mouth, minimal improvement. And I'd seen online some like images like before and after people that have had this done. And It varies. And the doctor really was very clear with me. She didn't set me up to think that this is going to, be a miracle thing for me. And I really think I kind of knew instinctually going into it that it wouldn't be. So I'm not disappointed. Obviously, would I have loved to have maybe more of my smile come back as a result of it? Sure. But it is what it is. But I do think when I smile with my mouth closed, I do think that I can almost feel it. I can feel like more movement, which even just kind of from a subconscious standpoint, when I'm smiling, feels nice to kind of feel like when I smile, I can kind of just tell that I am smiling more, as opposed to really being frozen on this side. And then even like, what you can see about, I have like a little bit of like it's like a dimpling there, I guess you could say. So I just, again, miracles weren't performed, but I do think it's an improvement, which I appreciate. So yeah, so that is pretty much it. Trying to think of anything else. No, I don't think there's anything else to mention. Again, I guess to recap, I'm happy I did it. It wasn't a miracle, but I did get improvement with the synkinesis. I do feel like my smile came back a little bit. There's just a little bit more action going on over here now than there was before. And yeah, so that's it. So anyway, I hope this video you found to be helpful. And if you are in the recovery process from facial palsy, I hope you're keeping your spirits up and that I hope your recovery is going well. Have a good day.